Hello everyone, I'm Dirk Hines and I'm a family physician. In previous videos, I discussed current research that suggests a plant-based whole food eating plan seems to produce better long-term results in preventing and treating diabetes than other eating plans. In this video, we will continue to address dietary changes to get diabetes under control or even into remission. The topic today is dietary fat. Fat is the one macronutrient that many people avoid, believing that it is the least healthy compared to the other two macronutrients, carbohydrates or proteins. We need to eat fat. Every cell of our body is surrounded by a membrane comprised mostly of fat. Our brain contains a large amount of fat, and fat can be used to store extra calories from our diet, as well as being a primary energy source. Fat is also broken down in the intestines into fatty acids that can enter the bloodstream to be utilized by our body. Therefore, it can be used to make special chemicals that our body needs. There are several different types of dietary fat. First, saturated fat occurs in meat and dairy products, as well as coconut and palm oils, known sometimes as tropical oils. This type of fat increases bad or LDL cholesterol, which contributes to plaque buildup in the arteries. Second, unsaturated fat is healthier than saturated fat and can occur as mono or poly, such as you'll see on the nutrition facts on all food labels, as you can see on this bag of pecans. Mono unsaturated fat also comes from some meat and eggs, as well as avocado, seeds, nuts, olives, peanuts, and unrefined plant oils. Unfortunately, when plant oils like vegetable, sunflower, or canola oils are heated to high temperatures, they break down into unhealthy fats. Monounsaturated fat lowers bad cholesterol as well as improves the control of blood sugar levels. The other unsaturated fat is polyunsaturated fat. Foods rich in polyunsaturated fat also contain two main types of fatty acids that our bodies need in the right amounts. These are omega-6 and omega-3 fatty acids. Omega-3s can lower the risk of heart and blood vessel disease and improve blood sugar control. People should try to boost their intake of omega-3s. Omega-6 fatty acids are found in foods such as corn and plant oils, while omega-3 sources include oily fish such as salmon, in addition to green leafy vegetables, walnuts, flax, hemp, and chia seeds. Having diabetes can make it harder to use healthy omega-3 fatty acids from the diet. Some people may benefit from taking omega-3 supplements while on a plant-based whole food diet. The final type of dietary fat that I would like to mention is trans fat. This type of fat can raise bad cholesterol and lower good cholesterol. It is found naturally in small amounts from meat and milk, but the largest source is from plant-based oils that have been treated to be solids at room temperature, such as shortening and margarine. Also, when foods are processed, it is often trans fats that are added to food for taste and consistency. In our American society today, many processed foods have added sugar and trans fats. It is very rare to find natural foods that are high in fat and sugar. Worse than sugar alone, the combination of simple carbs and fat together are known to stimulate a very large insulin response that can lead to insulin resistance, the root cause of type 2 diabetes. Packaged foods, pre-made meals, fast foods, and foods with a long shelf life at room temperature usually contain fat and sugar together. The healthiest and best option for blood sugar control, as well as maintaining good health of your heart and blood vessels, is consuming moderate amounts of omega-3 and small amounts of omega-6 fatty acids in the diet. Eating more unsaturated fat and less saturated or trans fat is also important. Adding greens, walnuts, chia, hemp, or ground flax seeds to your foods regularly is the best way to boost omega-3 fatty acids in your body while eating a plant-based whole food diet. Most guidelines recommend fat making up 10 to 30% of your daily calorie intake. Popular diets such as keto or carnivore diets may have as much as 65 to 75% of calories from fat. Remember that each individual may have different nutritional needs and food preferences. Eating plans need to be individualized to find the right balance of types and quantity of fat for each person. However, eating large amounts of fat, especially saturated or trans fats, has been linked to long-term weight gain, even if weight may go down short-term on a keto or carnivore diet. High fat intake can also cause disease of your heart and blood vessels, increase inflammation and insulin resistance, and lead to an increase in death from all causes. Fat is the most calorie-dense macronutrient. It contains more than twice the number of calories as carbohydrates or protein. 1 tablespoon of oil is 14 grams of fat and approximately 120 calories. This is about the same as a quarter cup of nuts or seeds, 2 tablespoons of nut butter, 1/2 of an avocado, 1/2 of a cup of coconut, or roughly 20 medium olives. As an example, this 1 serving of pecans contains 21 grams of total fat. Breaking down this fats on the food label, there are 2 grams of saturated fat, 0 grams of trans fats, 6 grams of polyunsaturated fat, and 12 grams of monounsaturated fat. This is actually a healthy fat option when eaten in moderate amounts. In 2021, the American Heart Association recommended replacing meat, dairy, and tropical oils with unrefined plant-based fats. Doing so resulted in a reduction in the risk of heart attack by 30%. This is a similar reduction as taking statin drugs such as Lipitor, Zocor, or Crestor. Avoid fried foods as much as possible and limit or avoid oils as well. If cooking with oil, use more heat-stable products such as avocado oil. Even extra virgin olive oil breaks down into unhealthy fat when heated very high. Fat is an important macronutrient that is needed by our body. Due to the high consumption of meat, dairy, and processed foods, as well as fried foods, in our standard American diet, we overconsume unhealthy fat. Many of the foods we eat contain a combination of sugar and unhealthy fats, which are a dangerous duo, making it difficult to control blood sugars. Focus on getting healthy unsaturated fats from foods like avocado, olives, nuts, and seeds consistently in your diet, and limit or avoid oils as a rule. Please be sure to speak to your personal medical provider before significantly changing your diet. Thanks for listening. Have a healthy, fantastic day.